So good evening. This is Tim Gibbs with Delaware Health Force. Delighted to have you here for Delaware Mini Dental School. Our apologies for the technical issues last week. However, for this series, the required attendance will only be 5 sessions for a certificate. And that's the way technology works sometimes. So this is a partnership between the Sussex County Health Coalition, the Delaware State Dental Society, and the Academy of Medicine, who's been running Delaware Mini Medical School since 2009. As I mentioned, the stream is live on YouTube, or if you go to youtube.com/Delamed302, you can click on live and you can find the live stream there. Just the real brief history. We were founded in 1930. This is the literally second to last mini med that will be funded by ARPA funding. And so we're real excited about that. We had a goal initially to have 2,500 students go through our program. We're going to well double that and exceed 5,000 students. So thank you all for being here and being part of that amazing number. There's no continuing education for this. So if you are a professional, this is not CME or CE accredited. You can attend as many or as few of the sessions as you would like. However, if you're going for that certificate of attendance for your college transcript or for high school volunteer hours, whatever, you do need to attend all of them. There are no grades or tests unless you miss one and you get permission to make it up, in which case you'll communicate with Nicole Sabine, and she will send you a short quiz after you've watched the makeup session. And again, partnership between the Academy, Delaware Health Force, between Sussex County Health Coalition, and the Delaware State Dental Society. Housekeeping tips: this is a webinar. This is not a Zoom meeting, so you can see us. We can see each other, but we can't see you. You don't need to have your cameras on. Save bandwidth. Please use the Q&A feature to ask any questions. As most of you probably know, questions are answered at the end of the presentation. A lot of them will be housekeeping related, and Christy and I will handle those as we go along. Please don't ask questions of a personal nature. If it's something about a dental condition that you have, just generalize the question and ask it that way. It's just for privacy purposes. Remember, to be qualified as attending, you need to be here through the entire presentation. But once Dr. Vatnika has concluded his presentation, Q&A starts at that time. You can leave. Wanted to real quickly, for that portion of you who are getting ready to take the MCATs, and there are some of you who qualify for that, Christiana Care and the Harrington Trust are doing a free virtual MCAT prep program. The barcode is there. And if you are interested in more information, what I would recommend is probably you snap a picture of that barcode or the QR code right now. We can certainly send this out later as well. At this point, I'm going to turn it over to Christy Hanley with Sussex County Health Coalition, my co-host, and she'll take it from here. Christy.
Great. Thank you, Tim, and welcome to everybody this evening. We're glad that you can join us. Just a little quick blurb about what Sussex County Health Coalition does. As you can see on the slide, we are focused on making sure that we are engaging with our communities in basically Kent and Sussex County. We want to make sure that we're focused on the efforts to improve their health care of their children, the youth, and all the families involved. We want to make sure they have a voice in an area to voice their concerns and ideas regarding their own communities. We want to make sure that they're engaging with others from the communities, and that we are developing community resources designed specifically for them. Next slide. And this is just a schedule of what the next few weeks are going to look like. And this evening, we are happy to have Dr. Tedi Vatnika, who is a physician here in Delaware. He graduated summa cum laude from Rutgers University before earning his dental degree from Temple University School of Dentistry. He developed a strong foundation in patient care through several years of general dentistry practice in Lancaster, Pennsylvania. Completed a rigorous 2-year residency at Temple University, specializing in advanced root canal therapy and microsurgery. He is dedicated to utilizing the latest endodontic technology to provide high-precision, patient-centered treatments, and he combines extensive clinical experience with specialized training to deliver exceptional care in complex cases. We're happy to have you, Dr. Tedi Vatnika. It's over to you.
All right, thank you. Pleasure to meet you all. Thank you for attending. So I'm going to share my screen here. All right. For today's topic, well, first of all, I'm an endodontist, so like they mentioned, it's a root canal specialist. So I'm going to start today's presentation talking a little bit about the journey of getting into dental school, starting with your undergrad experience. And then towards the end of the lecture, we'll move to talk more focused on what endodontics is and why it is a specialty. So I'm not familiar exactly with how many of you are actually interested in dentistry or just considering it. But we'll talk a little bit more about what makes dentistry unique as well. So dentistry is not only just a medical field. We're not just focused on oral health, we're focusing on overall health. It combines both your clinical skills, your hand skills, your science background, but also technology. So throughout the years, the biggest changes in dentistry has actually come from technology. We've seen a lot of advancements. Cases have become more predictable. We're able to do a lot more things that we wouldn't have even thought of doing before. I know currently a lot of talk about regenerating tooth buds or just new teeth. So that dentistry not only combines diagnostic information, preventive medicine, but it also treats oral disease. And there can be many different pathways, as we'll get into briefly in the next few slides. So some things you can do after graduating dental school, you can go straight into dental practice in a private office. You can specialize, or you can do a hospital-based GPR or AGD program to further your skills. You can join the military, practice ownership, academia, research, as well as public health as well. So why choose dentistry? So there's several reasons why people go into dentistry. First and foremost, you're helping to improve the patient's life you treat. You build a strong relationship with your patients and in the community that you serve. It is a good earning potential, but nothing's ever guaranteed, so everyone is going to be different. You definitely have a more flexible schedule and work environment. Most dentists aren't working 5 days, some like myself will. And then you also have the opportunity to get into practice ownership, entrepreneurship. In dentistry, unlike medicine, you don't have to specialize in order to perform a specific procedure. So, although I'm an endodontist, the general dentist can perform root canals. You don't have to be a specialist to place implants or extract teeth. It all is based on your education and your training and level of comfort. The specialty practices really are there for the more complex cases that a general dentist may not feel comfortable handling, or in certain cases that, some dentists just don't want to do certain procedures, such as root canal. So those get referred out to the specialists. You do make meaningful impact in your community. You do get to know a lot of people through your career. And like I mentioned before, it's a blend of not only science, but hand skills, problem solving, getting you to think outside the box. So some skills that are needed to be a dentist, and these are things that schools are going to be looking into as they go through your portfolio when you're applying. Some things could be communication skills, which is based on an interview. a lot of the communication skills would be learned throughout time, but when you're talking with patients, you need to have develop trust and empathy through them. There's also manual dexterity, again, that's learned, but a lot of schools would like to see some sort of hobby or something like where you're using your hands. Um, Overall, you need to have a mindset that you're willing to grow and keep learning throughout your life. You never stay stagnant in dentistry or any medical field. There's always advancements coming in. All right, so down to the bread and butter. So what's needed for dental school admission? So every school is going to be different, but they all have the same basic framework of what's required when you apply. So first off, they look at your academic performance, your background, prerequisite courses, your exposure to dentistry through shadowing, and the main factor that they're going to look at after the GPA is going to be your DAT scores. That's the dental admissions test. So this is a great way to standardize how much you've learned throughout your education. Every school is going to be different. They try to weigh out GPAs as best as they can, but the best way for them to weigh it out is through the DAT. So, even if you may have struggled first or second year in school and made up for a third or fourth year, the DAT can really show that you were put in the effort to learn all that material. And then they also look for other experiences such as leadership or volunteer opportunities. And the key factor to applying is going to be prepare yourself and apply early. The earlier you can get everything ready, the better. It's a very highly competitive field to enter. So the schools, not only are you competing with the students, the schools are competing with themselves too. So they like to get things going as quickly as they can. So for undergraduate education, uh, typically most schools will require a 4-year degree, it's like a bachelor's. And then each school will have prerequisite courses. So there isn't a specific major that's required to apply to dental school, but there are courses that each school has. Some may differ from each other, but the basic ones would be biology, chemistry, organic chemistry, and physics. Then some other schools may ask for, so these four are really the basics that are required by all schools, but other schools may ask for biochemistry, microbiome, anatomy. In general, most of these prerequisites, although not all schools were required to take advanced course like biochemistry, if you take it, it's going to look better. They really do look to see how much you challenge yourself while you're in school. A big thing is a lot of people will take biology as their major because it will cover all of these courses. But in theory, you don't need to major in biology to get into dental school. And I think a good word of advice would be to major in something that you enjoy and that you can see yourself doing, because plans change. Maybe you don't end up going to dental school. Maybe you change your career path. You really want to base your undergraduate degree based on something you want to spend the rest of your life doing. And the big thing is focusing on your GPA, especially in the science courses. That is going to be heavily weighted when they go to review your application. So again, we talked about manual dexterity. Not a complete prerequisite, but they do like to see that you're involved with your hand-eye coordination or just details. So hobbies are a great way to show them that you're very good at your hand-eye coordination, such as art, painting, playing a musical instrument, or even building. This is typically a question that comes up at most interviews. They'll like to ask, what type of hobby skills do you have that involve your hands? So the DAT. So recently they have changed the way the DAT is graded. It used to be a 2-number system. Now it's a 3-number system. And basically it's a standardized exam for dental school admission. And imagine
It's not the greatest profound. It's not. Yeah.
so it measures your knowledge and problem solving skills, and in several sections. So there's biology, organic chemistry, chemistry, the perceptual ability, reading comprehension, and quantitative reasoning. And these are all learnable subjects. So there's many books out there, a lot of courses that you can take that will kind of hone in on it specifically what to study on for the dental admissions test. So you're not kind of just going all over the place. The perceptual ability portion seems to be the portion that most people are unfamiliar with when they're learning for it. It's a completely new thing for most people. It's kind of testing how you're able to mentally view shapes and objects. And again, in these tests, they definitely do weigh the science portion more than the remaining portions. But now with the three number system, it's kind of, I think it's more equally weighted than they used to be. Shadowing. So shadowing will allow you to observe a dentist hands-on to understand how the day-to-day life is, or patient care, how you're juggling between patients, staff, and it gives you just more of a real world experience of what it will be like working as a dentist. I would recommend not only shadowing general dentists, but also specialty dentists, just to get a better understanding of how each type of specialty works and how they interact with each other. Yeah, it's best to kind of do this over time, shadowing, rather than just one, like a week of shadowing. It's better they like to see that you've been doing it consistently. I don't think you have to go every week. I did. I think it's a little overkill. But as long as they see that, over 3, 4 years, you've been once a month, twice a month, going to different offices to observe. I think it's more important to do multiple offices than the same office over and over again, because it gives you, again, just another idea of how a practice can be run. Next, so most schools will require at least one or two or three letters of recommendation, and this is something you should start working on early because everyone's busy. Your professors may be busy, so you want them to be thinking about this ahead of time. And when applications open, you would hope that they have it ready to submit. They want to monitor, they want to look at your character, your work ethic, your readiness for dental school. So they do ask specific questions based on each aspect. So they may ask, what is this student ethical? What have they done that's ethical? So they really like to get to know you, which means it's important that who you're asking to write the letter for you also knows you, so they can write a more powerful letter. So some things, some ways to build a relationship with those professors is to participate in class, go to office hours. And it's a good idea to give them a resume or a personal statement just so they have a good idea of who you are and what it is that you're aiming for in that letter. So personal statements, this is one of the parts of the application where you actually can control the narrative. So it is important. Admission committees will read each essay and let's see which one will stand out. So authenticity is important. Strong strong essays will focus on reflections rather than just listing what you've done. And it's a good idea to start revising the letter, the personal statement early on in the application, because your first draft is usually not the final draft. You may change completely what you think you want to write about as you go through it. The biggest things you want to highlight your experiences, how you've changed throughout your undergrad, why you are a good candidate for the dental school, why you want to go into dentistry, any growth or challenges you may have had. This is a good time to also touch base on any downfalls you may have, whether it's a GPA or you got into trouble or anything like that. It's a good time to touch base on that. And while instead of denying any blame, they like to see that if anything happened, that you are accountable for it and you grew from it. and school selection. So when you apply, the more schools you apply to, the higher your chances are of getting in. So there's several factors you can look into, such as location, cost, type of clinical experience, class sizes. Does a school have a specialty program you can apply to? Versus if you don't want to specialize, maybe you want to go to a school that doesn't have a specialty program, so that way you get more procedures. But again, the more schools you apply to, the better your odds are. So some people may want to apply to schools just in a certain area because it's close to home, but this will really limit your chances of getting in. If every school has a 10% acceptance rate, applying to one school is going to definitely lower your chances of getting in. All right, so when we talk about GPA and DAT scores, these aren't, guaranteed admissions rates, but the average is based on overall schools, but every school is going to be different. Usually overall GPA that they accept is between 3.5 and 3.7, and science GPA is between 3.4 and 3.7. Some may be lower, some may be higher, depending on the school. And again, the new DAT scoring system, the weighted average of acceptances, it's between 430 and 470. I'm not too familiar with exactly how this score works compared to the previous scores. But generally speaking, you want to try to get at least the average for most schools in order to be considered a strong applicant. You also want to show that your trends are moving upwards, meaning that if your first year you didn't do great in undergrad, that your second, third, and fourth year you've improved. Again, like I said before, a strong DAT score can outweigh a GPA. And same as with applications on the DATs, you really want to apply early and time when you take the test and when you apply. So a good time to start taking or start preparing for the DAT is early junior year, and take it with it in spring or summer. So applications will open in May, and your application will be incomplete until the DAT scores come back, which could take a month or two for them to give you your finalized score and upload it. Meaning that if you decide to start your application in May, but take the DAT in July, your application may be incomplete until September. So the earlier you take it, the better. If you can take it before the application opens, it's even better. Again, biology, general chemistry, and organic chemistry will be tested on the DAT. So it's a good idea to take these courses beforehand. That way you're prepared for the exam. Once you start studying for it, it really becomes review more than learning new subjects. Now most schools are using the application online, which is just a centralized portal. You'll upload all your information to one website, which makes it a lot easier. So all your transcripts, anything that, personal statement, letters of recommendation, all go to one portal. And then that portal will send it out to the dental schools. So when you select all your dental schools, you'll go onto the portals. You'll click out of I believe there's 70 schools now. So you'll click the schools you want to submit it to. You pay a fee. And once it's submitted to them, those schools typically ask for a supplementary application, which you will have to send directly to them. And that may also be a separate fee. Again, it opens in early May. Most people will have it submitted by June or mid-June. And it's important to do so because the earlier you get in, the higher your chances of getting an interview are. Submitting it later on, some schools may have already selected all their candidates. So you may have missed out on the opportunity for certain schools. Again, the application is going to include everything we've talked about so far. So transcripts, DAT scores, a list of like a CV. So it's going to list your experiences, activities, a personal statement, letters of recommendation, and a school selection. once the application's submitted and your DATs are taken, that's when you become a candidate to get an interview. So typically interviews will start in early, usually around summertime, or sorry, September to winter. With the first acceptance is usually around December 1st. Interviews can be virtual, in person, or hybrid. Usually it's one day. They give you plenty of time to prepare for the interview. Usually it's a few weeks ahead of time before you get your invite. And it will be with multiple students at the same time. So maybe 20 or 30 other people there that day taking the interview with you. A lot of common topics during the interview questions would be why you choose dentistry, what are your experiences, any strengths. They will ask ethical questions such as, things that you've done that are ethical. Why are they ethical? And some ways to prepare this is to you can take mock interviews. Your pre-health advisor, pre-health committee could provide an interview for you. There's question banks usually available online of what schools or what each school typically will ask during the interview. And it's also important when you go to the interview, you dress professionally. So, don't wear something you would wear to a wedding. I want to wear something that you would wear to a job on Wall Street. They really do, judge not only your character, but how you're presenting yourself, including how you're dressed that day. All right, so the admissions process, once you've submitted everything and had your interview, the schools will then look at everything holistically from the admissions cycle. So they'll take into consideration your GPA, your DAT performance, your interview, how well they think you fit for the program. And then typically, like I said, around September is when the first interviews start, and the initial acceptances are around December 1st. But they can keep going throughout the year, depending on, sometimes a candidate may choose a different school, so they'll back out of the school, so new positions will open up. I've even had in my class, it was the first day of class, someone didn't show up, and they immediately put a new student in their place. Those common mistakes you want to try to avoid, again, taking the DAT too late or applying late, not shadowing, or having a generic personal statement, any weak letters of recommendation, again, asking someone that may not know you well, or applying to too few schools. This is definitely a mistake a lot of people make. The more schools you apply, the higher your chance of getting in. And schools will typically ask how many you apply to. So if you were to tell them 5 schools, it may show them that you're not really devoted to the profession. And again, poor organization and missed deadlines. So timing is definitely the most crucial and controllable aspect of it, and it'll give you the biggest advantage over everything. You may not even have a strong GPA or DAT, but you can still increase your ability of getting in by applying early. So dental school landscape. So overall, there's about 70 accredited dental schools in the United States, with roughly 11,000 to 12,000 applicants each year, and class size is 6,500 to 7,000 students. That means that approximately 55 to 60% of the applicants each year will be accepted into a dental school. It is competitive, but realistic, so meaning that you can get in. And the goal is to apply to multiple schools. So each school will have a lower individual acceptance rate. For example, if 1,000 students apply for 100 seats, it's a 10% acceptance rate versus the 55% that you're seeing here. Once you get into the school, you have to drop out of all other interviews usually. So that will open up spots throughout the year. And so the really big key takeaway is try to apply to as many schools as you can. If you really want to get into the field, the more you apply to, the higher your chances are of getting in. Right. So there's plenty of other helpful resources available online. So there's pre-health committees, offices, pre-health clubs you can join in your school. Science faculty can help guide you through. And again, online you have the ADA, so American Dental Education Association. They have a website, Go Dental, as well as Dental School Explorer, that can help you guide through each dental school, their requirements. It's important to do this early on so you can kind of understand where you need to be by the time the applications cycle comes around. Not only what to expect, but you want to prepare yourself in terms of what classes you've taken, when you're applying, when these schools open their application cycle. And you can also check out their official school websites to get more updated and individualized requirements. So once you've gone into dental school and completed dental school, it opens up several different career paths. So as a dentist, you can go directly into private practice as a general dentist as soon as you graduate. So you're not required to take a residency of any sort. It just depends on how comfortable you are going right into practice. You can also take a general practice residency or an AEGD advanced education in general dentistry. So these are both geared towards general dentistry. GPR would be hospital based. So you learn a lot more about inpatient care, emergency medicine, versus AEGD is more academia. So usually typically it's in a school setting. And usually in AEGDs, you will learn more advanced skills on average than a GPR because that's just what it's geared towards. GPRs are seen as a regular hospital-based residency, so it is paid versus AEGD, which is usually not paid and you have to pay tuition. You can also apply to specialty training. There's several specialties you can apply to, and each training it goes from 2 to 6 years, depending on the program you choose. You can also go straight into working in the hospital, public health, or the military. You can get a degree in public health while you're in dental school. The military typically will pay for your schooling, but then you would have to give back those years in service. You can also go into teaching or research, or you can do a combination of each of those. For example, I teach on Fridays, so 4 days a week I'm working in the clinic, and one day I'm in the hospital teaching the residents. So this is a list of the dental specialties. So there's orthodontics, which specializes in braces or mastication, or oral and maxillofacial surgery is usually more surgery heavy. That covers a lot of different types of surgeries, not just wisdom tooth removals. It could be a fractured jaw or cancer, taking biopsies. Periodontics is typically focused around implants and gums. Prosthodontics is on dental prosthesis, so it's similar to general dentistry, but they're focused more on anything fixed or removable, so crowns, bridges. Some may even go into facial prosthesis, so they may make ears, eyes, nose, but that'd be further training in that field. Pediatric dentistry, endodontics, which is root canals, oral pathology and oral radiology. Typically, those both will be hospital based. Oral radiology can be a great career if you're somebody that likes to work from home. Dental anesthesiology, typically with dental anesthetists, they are dentists that, again, went into anesthesia training, and typically they rotate between offices. So they don't, as a dental anesthesiologist, you typically don't have your own office. You may have your own business where you're hired to provide the anesthesia for the dentist to provide the work. And then public health dentistry. Again, you can get a degree in public health or just go into public health if it's something that you found throughout your career that you enjoy doing, which you do get many opportunities to do while you're in dental school. right, so next we're going to move into endodontics. So again, what is endodontics? So typically when people think of endodontist, they just think of root canal specialists, but we're mainly focused on diagnosing and treating disease with the dental pulp and the surrounding tissue of the roots or teeth. So that means it's not, typically most of those diseases are solved with root canals, but the biggest part of our specialty is actually being able to diagnose. We're typically the ones that get patients sent to us by other specialists to determine the origin of the disease, whether it's tooth related or from the surrounding tissue. So we focus on diagnosing tooth pain, treating diseases of the dental pulp, performing root canal therapy, managing dental trauma, performing endodontic microsurgery, and with the biggest goal of saving the natural tooth when possible. So again, most of the time people associate endodontics with root canals, but we also treat other cases such as trauma, or sometimes we will do stem cell regenerative therapy, which we'll talk a little more about later. So this is a figure that shows the tooth. So the outer portion is made of enamel. It's the hardest substance in the body. And then the inner portion is dentin, which contains microscopic tubules that transmit sensation into the pulp. This is how you feel. There's little nerve innervations going through the dentin tubules. And in the center of the pulp, it contains blood vessels, connective tissue, as well as nerves. So it's not technically, when people think of root canals, they think you're removing the nerve. Although there's nerves there, there's tissue in the center of the pulp, similar to the rest of your body. Now the pulp extends from the center of the tooth down into the roots through tiny canals, and those are called the root canals. And when bacteria enters the pulp through a cavity, a crack, trauma, the pulp can become infected, and that may warrant a root canal in order to remove the infection, alleviate the pain, and preserve the tooth. So what are some common causes of root canals? So root canals are needed again when the dental pulp becomes inflamed or infected. The most common is deep decay, which is a cavity that gets close enough to the nerve where bacteria or their byproducts can affect the nerve. They can start as inflammation, which can cause the pain initially, or progress into infection. Teeth can also need root canals because of cracks, fractures, trauma, or repeated dental procedures, meaning that if you get drilled multiple times, the tooth becomes inflamed and eventually it can become infected. Once bacteria enters the pulp tissue, the tissue cannot heal on its own, and an infection will develop over time, which can give pain, swelling, an abscess, and that's treated typically through a root canal. So you perform the root canal to clean and disinfect the inside of the tooth and alleviate the disease. So again, when we go back to diagnosis, so the first part of root canals is diagnosing, is there disease? Where is the disease from? So initially we'll take x-rays, either two-dimensional x-rays, as you see on the left side, the intraoral x-ray film, or CBCT on the right side. That would be a three-dimensional image. And with a three-dimensional image, you're able to look at each root individually to assess if there's an infection, cracks, or maybe there's a disease that's unrelated to the tooth that a two-dimensional image may superimpose on the tooth. So it may look like it's coming from the tooth when in fact it's coming from surrounding tissue. It's a lot, 3D X-rays are a lot more detailed. It gives you a lot more info if there's any fractures, resorption, or just complex root anatomy. So it allows you to be more detailed and plan your treatment. This is a cross section of a CBCT, so there's different views of the mouth as well as a 3D reconstruction. Again, traditional X-rays would be two-dimensional, versus the CBCT, which is three-dimensional. And CBCT stands for cone beam computed tomography. So it's similar to a medical CT, but in a much smaller field of view. So it's less radiation. It's very focused to one area. The smallest size, it can be a 5 by 5 centimeter section. So you can capture 2 to 3 teeth. Therefore, not only do you get a high resolution view, but you also significantly minimize the radiation dose to the patient. And again, this will allow us to view, complex anatomy, any fractures or cracks that can't be visible clinically or through a two-dimensional image, or just things that may cause a challenge in the root canal, such as resorption or an extra canal, which may be missed without the 3D scan. After the radiographic examination, we also do a clinical exam. Again, imaging alone cannot always determine everything that's happening. There's also a subjective portion to the patient. One of the common things we do is cold testing. It's called endo ice. So this is a way to determine whether the pulp is still vital or not. So meaning that if you can feel the cold, we can say with a bit amount of certainty that the tooth is still vital, versus if you cannot feel the cold, we can we start to lean more towards it could have an infection. There's also other tests such as percussion on palpation to determine if there's any inflammation, infection, check if there's any periodontal pocketing, cracks. And then there's an EPT, which is an electronic pulp tester, which actually sends electronic signal through the nerve to determine if the pulp is still vital, if it can feel it. And a big thing of what we want to do during the clinical exam is to replicate the patient's symptoms. So if a patient comes in saying that it hurts to chew, this is a great way to find out which tooth is bothering them. Or if they say it hurts to drink cold, so the endo ice would be a great way to determine which tooth that cold sensitivity is coming from. Not always will infection or inflammation be associated with pain, so it may make diagnosing more challenging, but by combining both the clinical exam and the radiographic exam together, you can have a pretty strong opinion on whether or not there is disease present. So the root canal procedure itself is, there's several steps. So the first step would be access opening and locating the canals. So the access opening will be drilling through the crown of the tooth into the pulp chamber. After you've access into the pulp chamber, then you have to slowly widen that access and locate the canals in each corner of the pulp chamber. Typically, we use magnification. Endodontists will use a microscope versus endodontists mostly will rely on their loops. This is a more up-close picture. So this outline will be your access. And typically the goal of your access would be to center each canal in the corner of the access. Now this view is under a microscope. So this is probably a 12x magnification to get it this close. And this is also after the canals have been cleaned. So typically these canals are much smaller than this. And without magnification, that can be challenging, if not impossible to see. So this is your operating microscope. So typically we sit behind the patient with the microscope and we can adjust the focus, the view. It helps with posture, so we're not leaning forward. And it significantly will increase your success rate. There's going to be fewer missed canals, meaning if there's an extra canal, you can find it easier. You can keep your access a lot smaller, so you can be more conservative in your treatment. We can also view cracks under the microscope that you may not be able to see otherwise. So after you've located the canals, the next step would be to start cleaning and shaping, which is done through a variety of small instruments used sequentially in the canals to make it larger. And then cleaning, we use an irrigation or a disinfecting solution while we are cleaning to disinfect and remove any bacteria or tissue from the canals themselves. Once we're fully done cleaning, irrigating, and shaping the canals, the next step would be obturating, which would be sealing the canals. We use gutta percha and sealer to seal the canals. So gutta percha is a rubber type material. It comes from a gutta percha tree mixed with other molecules to make it biologically compatible, stable over time, and retreatable, which is important. Obturation or sealing the root canal will eliminate or minimize the chances of it becoming reinfected. So while cleaning and shaping will remove the source of the infection, such as the bacteria or the tissue that's causing it, obturation will prevent it from reoccurring in the future. This is an image showing shaping of the canal. So there's a variety of different instruments that can be used. Every clinician has their own preference on which instruments, the type, the size, the shape, and even the flow of how they use them. There's no real set science. There's usually basic guidelines of how to do it safely and predictably, but from there, you typically will make your own workflow. And again, some things we talked about earlier, that dentistry relies heavily on technology. So these are more advanced irrigation or disinfection instruments. So you have ultrasonic on the left. So this vibrates in ultrasonic speeds to loosen up the debris, but also activate the disinfectant. We use lasers. It's similar to the ultrasonic. It's used to disinfect by breaking up the debris, getting the irrigant a lot further than it normally would. And lastly, we also use acoustic vibration, which uses sound waves to move the disinfectant into different areas of the root canal. So although all three methods are different, they do achieve the same outcome, with some being more effective than others. When we decide what we're going to use, it typically, we want to take into account the time it takes to use it, how effective it is over another modality, and the cost of the equipment. So an ultrasonic such as this one is quick, easy to use. When we move to lasers and acoustic, the cost goes up significantly. So does the time. It takes a lot longer to use them than it would in ultrasonic. So it may not be something you use on every case. It may be selective to certain cases that you think would benefit from it versus others. And obturation. So these orange cones that you see here are the gutta percha, and sealer goes into the canal. So the main purpose of the obturation, you want the gutta percha to occupy most of the space. So the gutta percha is, it won't shrink or expand with heat or cold, but it also won't fit the canal perfectly, 360 degrees. Although your instrument may be the same shape as the gutta percha, the canal never is. So the sealer comes in to fill all those little voids that the gutta percha cannot fill. So other than root canals, we also do endodontic retreatment, which is to redo a root canal. So although root canals have a high success rate, sometimes an infection may persist depending on the bacteria, or it may become reinfected over time. In those situations, you can typically manage them with an endodontic retreatment, which involves removing the previous filling material, recleaning or shaping, disinfecting the root canals, and sealing it again. And there's many reasons why a root canal may be needed. Maybe it could be that it became reinfected, or there was a canal that was missed, a new cavity started and brought decay into the canals. And sometimes there's just a complex root anatomy where it's impossible to fully clean the whole root canal system. After retreatment, we also have microsurgery. So this is similar to endodontic retreatment. It will be in cases where a root canal has failed or become reinfected. Or in other cases, it may be that a root canal is not possible, or retreatment may not be possible. If there's an instrument that's separated in one of the nerves while you're cleaning it, or if there's a pin or post placed into the root canal which cannot be removed, or like we said, if there's some anatomy that you cannot treat through a non-surgical root canal, then we typically would result to endodontic microsurgery. And what that is essentially it's doing a root canal from the other end. That's the easiest way to explain it. So we make an incision near the gum line, retract the gums, and we expose the tip of the root. We actually remove the apical portion of the root. So we resect the end of the root, and then we clean and shape the root from the apex, from the tip of the root. So we use ultrasonic instruments to clean inside the tip of the root and seal it. These are images depicting what a microsurgery is. So again, if you have an infection here, we would typically pull back the gums, expose the tip of the root, remove the infection, as well as about 3 millimeters of the tip of the root. And we use ultrasonics to go into the tip of the root about another 3 millimeters. And we disinfect and pack and seal it up and close it up again. Typically, the success rate of endodontic microsurgery is as high or higher than retreatments, with the overall success of both root canals, retreatments, and microsurgery being above 90%. So other than treating just root canals, we do treat dental trauma. So these are any sort of injuries to the to the tooth or jaw, alveolar structure. Typical injuries could be sports accidents, falls, motor vehicle accidents, or just physical trauma. And there are several types of injuries. It could be a fracture, displacement of the tooth, meaning that it was pushed in or out. Avulsion, which would be the tooth was completely knocked out, or just damage to the pulp from like a concussion injury, or if the tooth cracked and got into the nerve. Typically, we are the specialty that will be performing or treating most of the trauma cases. I know a lot of other specialists can have their hands in it, such as orthodontists. But inevitably, even after an orthodontist will see the trauma, they will send them to us to further evaluate and treat the teeth. The goal of treating trauma would be A, to either maintain the tooth vitality, or B, just maintain the tooth after an injury. So even after the tooth's been, avulsed from the mouth or fallen, knocked out of the mouth, we can still potentially save that tooth, whether or not a root canal is necessary. So, a lot of judgment has to be made on, do we need to intervene, and when do we need to intervene? And how can we stop any sort of pathologic process that the body may be having on the tooth. All right, and this is a newer branch of endodontics, so it's endodontic regeneration. There's still a lot of new research coming out on it. It's moderately predictable. What it is to preserve or revitalize a tooth that has become necrotic. So a tooth that's become infected, but in current applications, we're only able to do it with immature teeth, so teeth that aren't fully formed. So young patients that the root fully isn't formed. And the goal would be to reestablish vitality in order to allow continued root development over time. So, when this happens, usually it's a very young patient with underdeveloped roots that are thin or fragile. So our goal would be to strengthen them to hopefully keep that tooth for the rest of their life. What the regenerative procedure does is we actually go into the root canal, or go into the canal similar to a root canal. We clean, disinfect it, and then we stimulate stem cells to repopulate the root canal. And this is why it's only available in immature teeth, where they are abundant in stem cells. As teeth mature, you tend to lose your regenerative ability. Once it is regenerated, it can continue to form, and we will monitor over time to determine if it's still vital, or if we need to intervene with a root canal in the future. Again, endodontics is a focus on treating disease of dental pulp and the tissue surrounding the root. And our main goal is to eliminate infection, relieve pain. We want to preserve the patient's natural tooth whenever possible. It is a specialty that involves a wide range of procedures, including root canals, retreatment, microsurgery, trauma management, and regenerative treatments. And the biggest advancements in our field all come from technology, including the microscope, CBCT, or other disinfecting techniques. Okay, cool. Thank you all for taking your time to listen. If you have any questions, please leave them in the chat. I have my contact information here for you guys if anyone wants to reach out personally to ask any questions.
All righty. Well, we do have a couple of questions here. First question sort of harks back to the beginning, which is if you go to certain universities for their pre-dental program, do you have a higher chance of getting into the dental school available for that university? So you do the undergrad and then you go to the grad at the same school. Does that increase your chances?
It can, for sure. I don't think it's just about going to that school. I think by going to that school, you definitely have an upper hand. They want to keep their own students in. But you want to make yourself known in the dental school as well, meaning that you want to reach out to their admissions committee, or you might want to shadow in the school, participate in any events that they may have, whether it's volunteer. So in a sense, it does increase your odds, but I wouldn't base your decision on where you go to school on that specifically. It's hit or miss for sure. I think if the school has a dental school, I think it will help you, but I wouldn't go to a school just because of that.
Okay. So a follow-up question to that, or a variation of that question, would be, are there undergrad schools programs that historically create very strong candidates for dental school in general, regardless of whether they have their own dental school? Are there any out there that just have a really great track record on advancing people forward into this particular career path?
For sure, yeah. I think that goes with any school. I would say the more prestigious the school, the better your chances are. I know the University of Delaware does have a pact, at least I believe it's still ongoing. I don't know how long for with Temple though, where Temple will take a certain amount of students from the University of Delaware. And that goes with every school. So, if you went to Rutgers, their dental school may take 10 students from their undergrad, for example. So you definitely have better odds at specific schools. There's also like a 3+4, 4+4 program where you can apply to as a high school senior or junior. I can't remember. But it pretty much, that's probably the best way of getting into dental school because it almost guarantees your acceptance in a sense. But that's based on, your SAT scores or your undergraduate GPA. So they have a certain amount of requirements. They have to meet a threshold before you can apply. But once you're accepted, you get put into a path where, your next 8 years are kind of put in front of you. And it's specific to each school. So for example, Temple might have a program like that with Delaware, I'm not sure. So it's not just any school, it'll be school specific.
Okay. So this is saying something about how old I am. Would you recommend taking AP physics or AP physics and calculus in high school, or just take normal physics?
I would say the more AP you can take, the better. Even if you are going to retake it in undergrad or take a higher level in undergrad, It's going to look more favorable. It's going to help you. It's going to definitely help you get into a school of your choice. So, if you want to be in a more competitive program, they're going to look at those types of things.
Right, right. Um, so so we know it's expensive, but approximately how much does the complete dental school education cost? And let's do just the dental school part, not the undergrad part.
Without living expenses, tuition alone varies greatly between each school and in or out of state tuition. So I know in like California, some schools are like 35,000 a year. I think Rutgers used to be like 35,000. I'm not sure what they are now. Um, my education was 70,000 a year, I believe, at Temple. Overall, with my specialty training, I probably was just shy of 500,000 in debt.
Yeah, yeah,
Um, there's definitely cases of people getting into more debt, into close to $1 million of debt. You definitely want to be wise with how much you take out because you don't want to be a dentist and living like a student.
right. Well, not for a significant portion of your life
Yeah.
anyway. Yeah, so that from an expense perspective, for those of you who are more familiar with our Delaware Mini Medical School series, that puts dentistry and medicine in the same realm of total student debt over time. And just so that you realize that we're talking about ranges here, dental school can go from 200,000 to $500,000 plus. So it really is very dependent on what school in particular you're talking about. The private institutions will probably have a higher price point, although if they're well endowed, they may also have additional scholarship options, which is always something to be thinking about. Let's see. There was another question, but I opened up too many windows, and where did my questions go? Um, are both of the doctors? I don't know what that means. Linda, can you type that again? Adding on to the previous question, is the debt from dental school significant to the point where you feel it throughout your life, or would you say that the career makes the loan easier to pay off? Uh, well, easier to pay off. I'm not going to say in a sense, easier to pay off.
Um, I think it matters person to person. Again, I think some people may take out more debt than they need. Um, while you're in dental school, you're not working. So if you want to live a lavish lifestyle, it's easy to get loans. And they add up very quickly.
Yeah,
And then after dental school, there is no real set salary for a dentist. It varies so much based on your abilities, whether not just clinical, but your personal abilities. Do patients like you? Do they trust you? Can you solve the treatment? What treatment can you do? How much can you do everything, or are you referring stuff out? Every state is going to have a different income. Or do you work in a private office versus corporate office versus are you an owner? Um, all these are going to greatly increase your income. Um, Overall, I don't think the student loans are a major burden. It just becomes part of my monthly payment. I mean, it's like having a second home.
right, right. The other thing for students who are considering a career as a physician or as a dentist and some other types of healthcare providers, that there are a lot of student loan repayment programs. So once you graduate you're a practicing dentist or whatever, you can apply for and perhaps get accepted into programs where you'll be committing to working in a particular place for a period of time. And in return, what the state gets from repaying your student loan is they get a newly trained practitioner in an area of need, might be a federally qualified health center or a rural area. And what you get in return is having your student debt reduced. And then at the end of the period of time, usually, 2 or 3 years, maybe 4 years, depending on the program, then you are free to move and, go elsewhere to practice. The hope by that time is that you will have really developed an affinity with where you're practicing and with that population, and perhaps you would stay. I think the other thing that bears saying is that if you think about the cycle of life of what age you are when you're, finishing, when you're ready to start practicing dentistry or medicine full time, is likely the time that you want to have a first home, start a family, maybe have kids. So there are a lot of things to consider for the younger students in the group. Just remember, we had this conversation. Don't start stressing about it now. For those of you who are in, undergrad, this might be something you want to be thinking about more, because it is part of, the adult practice of, as you say, managing your money, living within your means, and definitely not, coming into practice burdened with an incredible amount of debt, which is therefore stressful and impacts everything else. Christy, I think, let me just check on the YouTube side, see whether there are any questions there. And there are not. Doctor, I appreciate you spending time with us this evening. Thank you very much. And just to remind, I saw a question which I think was referring to what happened to the other class. There were technical difficulties. We had to just cancel that class. So to get a certificate, you only need to have attended 5 sessions. We will see you all next week. Have a great week. Take care. Bye-bye.
Good night.